I am going to introduce Dr. Arthur Frank, who is a physician, occupational physician, who is an MD, PhD, and he's currently the chair emeritus of the Department of Occupational and Environmental Health at Drexel in Philadelphia. He's spread his knowledge to a variety of different organizations, including the University of Kentucky, University of Texas. Of course, he taught here in the early days, and he's been on a number of government panels, has been working in asbestos-related diseases for over 50 years, and was part of the United States Public Health Service for a number of years, and is the advisory board science co-chair. Dr. Frank is a legend in the field of occupational medicine. He's humble, he's quiet, he gets his point across, and his knowledge base is vast, and he's an amazing mentor, incredibly wise, and also has a tremendous, just knows everything there is about asbestos, and one of his areas of focus now is in India and looking at trying to improve awareness about the hazards as asbestos is shipped worldwide and causing havoc to come, and to make sure people are aware. So without further ado, Dr. Frank.
Thank you, Jackie, for those kind words. And it's funny, I remember what the first dean of the school once said when he was praised, actually by our class at the opening of the school. He said, "It's not what you think about me before you start, it's what you think about me 4 years later when you graduate or when you finish." But my connection with this institution goes back probably as far as anybody in this room. I was in the first class, as you heard, in 1968 when the school opened. I met Dr. Selikoff in December of that year. By January, I was doing an elective with him. He offered to sponsor me for my PhD, which I got through the Mount Sinai campus of the City University in New York. I was here for the groundbreaking of this building. I was here for the inauguration of this building when Gerald Ford stood up on this podium and inaugurated the building when he was vice president. It's the Annenberg Building, a family with great ties to Philadelphia, where I now am. And very importantly for me, it's where I also met my wife. I was a newly minted physician serving on one of the medical floors, doing my internal medicine training first before occupational medicine. And Joanne was the new head nurse. And 50 plus years later, with our 50th anniversary next year, this has a lot, this place had a lot going for me. And I left in 1983, but took with me warm feelings about this place and special feelings about my training with Dr. Selikoff. I was asked to talk about what he knew and what he fought for. Well, you've heard some of it already. What he knew was how to do good research. He started publishing his first papers about asbestos exposure in the 1950s. But how did he get to that? I mean, asbestos actually was not his first great contribution to medical science. Given the time and the era, we hear a lot about anti-Semitism at universities. He couldn't get into medical school in this country, so ended up going to Edinburgh. And was now during World War II. And for a year, he had to go to Australia because they weren't sure, how well people would do studying in Great Britain. Came back, finished, graduated. The industry once tried to poo-poo and say he never got his degree, and yet Sheldon Samuels, who was a great force at the AFL-CIO, has his copy of his medical degree. That reminds me to tell you that you heard from previously that the industry would go after him. They called Selikoff and those that were around him the Mount Sinai Mafia, who they thought were against them and their business. So I met him in '68, started working with him essentially immediately. But his previous call to fame had been when he got back from Great Britain. He actually worked at on Staten Island at a public service hospital out there, Seaview, and helped develop isoniazid, the first drug that was really successful in treating tuberculosis. For that, he won the Lasker Award. Now, how did he get into the asbestos business? He had opened up a clinic in New Jersey, in Paterson, and that was an interesting situation too. He was a groundbreaker there. Medicine at that point was individual solo practice, fee for service, and what they did is set up a group practice where you could sign up and come and get your care there. And he was the pulmonary doc, and he started seeing workers from a local asbestos factory in Paterson. And he started making diagnoses of asbestos-related disease, something he didn't really know very much about. Nobody, knew a whole lot about this. He was not the first to discover the ills of asbestos. That really goes back to the 1890s in Great Britain. In this country, well documented the first part of the 20th century, cancer recognized by 1942. But he then connected with the international, the union's headquarters in Washington after he studied locals 12 and 32 in New York City and in New Jersey. These were the asbestos workers union members, in addition to the factory workers, all of which he continued to study. Now, why did he go to the international? As he taught me and others, he invoked the Willie Sutton rule. Willie Sutton was a bank robber in the 1930s, and when asked, why do you rob banks? He said, well, that's where the money is. And Selikoff figured, if you're going to study asbestos, you go where the money is. You go look at insulators who work with this stuff literally day in and day out. So to his research and his advocacy, I'd also add that he was an educator. He educated many of us in this room that's been referred to already. But he not only educated professionals, he educated workers, and he educated politicians and the public. And I think his greatest claim is, in addition to his science and what he put out there, was bringing to the awareness, certainly of politicians. They used to come to his office, and some of us would be fortunate enough to sit in there for some of those meetings with them, educating them and moving things along as he could. He would hold international conferences. He had many conferences in this very auditorium, but the New York Academy of Sciences also would hold conferences with 3 major publications that he was instrumental in doing. And he got the secretary of what was then HEW before they changed it around. Now I guess it'd be HHS and what used to be a Department of Education, to put a notice in with Social Security checks saying, if you worked in a shipyard in World War II, you might want to talk to your doctor about asbestos exposure. And what groups did he look at? He looked at insulators. He looked at shipyard workers. He looked at auto mechanics. He looked at their family members. When we'd go over to New Jersey to the clinic where he followed the Paterson folks and the New Jersey local folks, not only would we look at workers, but we'd look at family members. Probably my worst day thinking that I'd like to do prevention was a study we did down in Baltimore, where in one day at a shipyard group of shipyard workers, we picked up 5 previously undiagnosed lung cancers, all from exposure to asbestos. I won't forget that day. I mean, that level of disease out of 100 or so people, none of whom knew they had the disease. So what he did was take good care, turned his research knowledge into care for people. And I'll just finish with my statement that what did he fight for? He fought to keep people healthy. And that's what many of us have continued to try to do. So thank you.